follicular unit transplant, FUT, is the strip technique. It's a procedure where you do a hair transplant that's lower cost, quicker, and very limited in dissection for getting the grafts. So FUT is where you take a strip from the hair and you take that strip out from the scalp, you process the individual follicles, and then you move them to the front in recipient sites or wherever you want to fill in. The way the procedure works is you make a fusiform or basically elliptical incision along the scalp where the hair is permanent, which is typically back here. You take out an entire strip of scalp and you measure before you cut. So you meet with the patient and figure out how many grafts do you want. Then, and how many do I recommend? Once you know this, you measure the density or how many grafts there are per square centimeter in the back. Then you plan your strip. Now when you plan your strip, typically you can take up to 2 centimeters in width. That's the most you want to push. And you can go pretty far out to the side. But if you go too far out, the hair is lower quality. What does that mean? So when you're doing any hair transplant, what you're doing is you're taking permanent hair and moving it where you have temporary hair. Now what does that mean? So in men, the hair in the frontal scalp, temporal scalp, crown, for many men is not permanent because it's sensitive to hormones, mainly testosterone. So with testosterone, the hair thins and you lose it, and with genes, your genetics. So when you're doing a transplant, you're taking hair that's not sensitive to those things and moving it to a new location. People often ask me, hey doc, why doesn't that new hair fall out? Well, hair has this really unique property called donor dominance. What that means is when you move hair from one part of your scalp to another, or from one part of your body to another, it's always going to act like where it came from. So the permanent hair all men have here, when it's moved to the front, it's going to act like permanent hair. Now when you do a transplant, you have to remember, if you want the best results, you have to do some kind of lifelong maintenance to maintain your existing hair. And my maintenance video talks about that, what you can do with your transplant to make sure you have the best long-term results. Now even if you don't do anything, a transplant will give you more hair. But with time, if you're having male pattern baldness, you're going to keep losing. So it's important to keep that in mind and think about what you're going to do. Now with the strip, let's compare the strip technique to FUE. With FUE, or that technique where you remove individual follicles with no big cut, the FUE is longer, FUT, or strip, is shorter. With FUE, you have to shave the entire back of the scalp. With FUT, you don't have to, because you just buzz the area you're going to cut, you tape above and below, you expose your strip, and you cut it out and stitch it up. So your donor area doesn't have to be shaved. The big advantage with that is for many people, especially for some women, they don't want evidence of having a transplant, or for many people's work, they can't have or they don't want short hair. Now as long as you're not going to keep short hair long term, then people won't know you ever had a strip. The strip incision, when I make it, I do a trichophytic closure. So I try to suture in the hair at the skin edges so the hair goes through the scalp so you don't see the scar. But even when you plan that, in the best cases, sometimes you can get a scar. And sometimes if you have a buzz cut, it's visible. Now if you wear your hair that's not a buzz cut, you're not going to see it. But if you ever cut it all the way down, you can see that line. Usually it's faint. Sometimes it can be thick, but that's rare. If you plan your strip properly, where you assess the looseness of the scalp, where you don't go too far out, and your closure is done well with the trichophytic approach, then that incision is really hard to see. Why would somebody get a strip versus FUE? Cost is lower. If you're not going to wear your hair short, it doesn't really matter. It's a lower area of dissection, or you're working in a smaller area. It's a quicker operation. So there are pros and cons to every approach. And the key thing when getting a transplant is you have to go to a provider, in my opinion, who can do many different techniques. Because with any surgery or procedure, if you try to fit the patient to the procedure, it doesn't work. The procedure has to be customized for that patient's goals, wants, and desires, and the end result. And that's how you get a wild success.